And get started. We're on Hendersonville time as usual. I see the one police officer in the room been looking at his watch for the last 10 minutes. But I know. For the rest of us, this is about on time. Today we have got How to Not Die, which sounds like a good plan. Preventing heart attacks and strokes, and Dr. Tracy Callister is our speaker today, and we're very grateful to Hendersonville Medical Center and all the physicians in town that help support this program. A lot of great information comes via them. Dr. Callister formed Tennessee Heart in Hendersonville in 1984, served many Nashville area hospitals with cardiac care. Graduate of UCLA School of Medicine, completed cardiology fellowship at the University of Vermont, and is a fellow of the American College of Cardiology. Board certified in internal medicine and cardiovascular diseases, internationally recognized leader in the field of CT, having been trained well beyond the ACC requirements for all levels. Diplomat of the American Board of Internal Medicine, cardiovascular disease. He says, stop, you want to get going, right? Well, he's extraordinarily well qualified, and we're grateful to have him, and thank you.
Thank you. I don't know who sent you all that garbage. I wouldn't have done that. Well, I don't know what they're thinking. I appreciate your time, and I'm going to go through a lightning tour of what I think people should know about how we can not die, which is kind of the goal. And let's figure out what I did wrong. So medicine's been around for a long time, and people have had a lot of options and a lot of doctors to choose from. You still do. And there's a lot of information on the internet, and some of it's very useful, and some of it's tomfoolery, and some of it's lies, and some of it's marketing, and it's hard to know. It's hard for you to know. It's hard for me to know. It's hard to keep abreast. Science changes. Your own fields change, and you realize how sophisticated it is, and medicine is very confusing and sophisticated, but it's important. We want, for ourselves and for the people we love, the chance to live longer. And how would we know? How could we as humans decide what we should pay attention to in this? When you go to a doctor, you go to feel better, and you go in hopes of living longer. And feeling better is hard to objectively measure. But living longer is not hard to objectively measure. And so let's take a moment and think about what have we known about people living. And if we go back to the earliest humans, Homo sapiens, go back about 250,000 years, so 250,000 years, and their average lifespan, when we dig them up and look at their bones, looks to be about 30 years. And if we go back to about 10,000 years ago, the early Neolithic period, it was about 38 years, and we go back about 2,000 years ago to the Roman period, the average lifespan was 35 years. That's well documented. The medieval period, it went to 42 years and actually dropped a little bit in the Victorian period in the 1800s to 1900s. And yet in 1950, we jumped to an average of 70 years in a very short time. And at 2010, we were up to 82 years, and we're adding about 2 months a year, and we're currently at about 85 years. Now, why? Why this sudden spike from 250,000 years, an average lifespan of less than 40 years, and then in the last 60 years, we've almost doubled that? How did that happen? And that is due to the science of Western medicine, when we started computerizing that. Let's look closely. If we look at the world and how long you live, we can see very clearly that those countries that use Western medicines in green have the long lifespan. And further away, the less you use, the shorter lifespan you have, irrespective of every other factor. People can live longer. And how much longer and how? Well, if we go back to before 1950, from 1900 to 1950, the average lifespan was 55. What did that mean? That meant that half the population would die by or before 55, and half would live longer. And so you would find some people who live into their 70s and 80s, but of all the people who started, it'd only be about 1 in 10. And half of them would die by age 55. Well, what is it now since 1950? How has it changed? And it's changed a lot. It's changed so that now the halfway mark is at almost 85, 84. That's a big difference in just since the time I was born. If science hadn't changed since I was born around 1950, I would have had a 50-50 chance, less than that, of being alive today. But now, right while I'm living, it's changing right underneath me. And half the people can get to 85 and half can go beyond. And the point of this talk is to make sure you understand how to get in that half and what really makes a difference. Because that's what we all want for ourselves and our loved ones. So let's understand that. What really mattered of all the tomfoolery and all the things people claim? Well, the first biggest chunk of jump came with sanitation and quarantines around 1900. That's where we started pushing it out. We understood the germ theory, and we understood that there was bacteria. In 1880, Semmelweis was the first guy who said, doctors, wash your hands, and the doctors who wash their hands had a lot less dead patients and those who didn't. And we started paying attention, and we quarantined tuberculosis and sanitation, and then we took a big jump when we moved into vaccine and antibiotics. Because the number 1 and number 2 killer was infections. And by cleaning up and treating these, we prolonged life. The last biggest jump, the addition, has been 2 basic things. The treatment of cholesterol and blood pressure, which you've all heard about since the 1970s. Treat your blood pressure, treat your cholesterol, treat this, go see your doctor. That's the big jump. And these simple things are where most of the money is. Let's take a quick look. Why? Causes of death. 2 million people die in America every year, and almost 1 million of them are due to heart disease, blood vessel disease, hypertension, strokes, heart disease. 500,000, cancer. Then after that comes accidents, violence. After that, chronic lung disease, diabetes. Accidents, violence includes car accidents. Lung disease, diabetes, now infections, influenza, the flu, and pneumonia, sepsis, that's blood, and kidney failure. But those numbers, 60,000 versus 900,000, are getting small. These numbers still are staying big. And let's drill in a little closer, look at what's changed. Let's look at heart disease in 1960, how many per 10,000 people each year would die, 559 to 217. That's a big drop, just since 1960. Strokes, 179 to 50, big drop. Cancer, 221 to 195. We're not doing very well in cancer. And remember what I just showed you before on antibiotics and cholesterol? 3 big killers were infections, heart disease, and cancer. And we're really doing good at infections, and we're getting better and honing in on heart disease, and we're not doing so good at cancer, and you all know that. You see the tragedy around you, a major killer, and we're not very good at that. Accidents already were coming down, but we cut those in half. Stroke, or suicide, we haven't helped much, but that's because it's a different kind of problem. Homicides, we haven't helped very much. Lung disease, unfortunately, we haven't helped very much. Diabetes, we are improving some. Kidney disease, some improvement. Liver, influenza is coming down, and pneumonia, and bloodborne infections, sepsis. So let's go through these and understand how to protect yourself. So what's the number 1 killer? It's heart disease. We want to understand heart disease. What is it about? It's about these little blood vessels. Let me go, well, I didn't go back. And let's see if I can figure out how to, yeah. So let's go back. No. When you're old and blind like me. So this is the heart. It's the size of 2 of your fists. It has these little blood vessels about the size of spaghetti noodles, and these are bringing blood to your heart, and your heart never rests. It works all the time, and those little blood vessels have to be open. And if they're not open, you're in trouble. And when we're young, they're lined with something that's not Teflon, but like Teflon, so you don't get clogged arteries. If you come to my office, there won't be college kids sitting in the waiting room. There'll be older folks. Why is that? Because I can tell you, college kids smoke, and they eat poorly, and they're overweight, and they eat lots of cholesterol, and they have high cholesterol. But cholesterol isn't really the problem. The problem is the lining of the artery. Because we all need cholesterol. We all have it. We don't need excessive amounts, but we need some. We'll make it if we don't eat it. It's whether it sticks in the arteries. And as long as you have that Teflon coating, it just bounces off. It goes on through. And we all have it when we're young, and as we get older, that Teflon lining wears out, and it's different for each of us. So you might be Winston Churchill and have terrible habits and cholesterol of 300 and smoke and live to be 90 because you keep the Teflon coating. Or you might be Jim Fix, a marathon runner and a vegetarian and a very low cholesterol, but lose that protective lining. And by 55, you're dead, and your arteries are totally shut down because it's that lining. And as that lining goes away, the cholesterol starts sticking, and it's all up and down the arteries everywhere. That's a 40 or 50% narrowing. And finally, one of those arteries gets 90%. And that's also a mistake. People say, oh, how tight is my narrowing? I've got a 90% or a 50%. But if you look, you got the junk everywhere. That's the one tight spot. It's not just that one spot. And that junk is corroding your heart, and it's corroding your head. And in the head, it leads to strokes and senility. And in the heart, it leads to heart failure, heart attacks, and death. And it's all the same process. It's all the same disease, and it's treated the same way. And the best treatment by far is the new cholesterol medicines. So this patient here, after just a year of his medicine, that's the same artery. The effective medicine. And that's why we're saving lives. Not because we're doing bypasses and stents, even though they are useful and sometimes are important, and that's where I make a living, but that's not the real large trick. The trick is get that open. Now, it's true, if you get a tight blockage, I can run a tiny wire up your leg, I can put in a stent and expand it and open it at that spot. But that plaque can go right back, or I can bypass it, it can go somewhere else. Those are for the last minute when you're really right on the edge, but that's not the best way. They taught me early that yes, a good doctor is ready to treat a problem when it's there, but the best doctor prevents the problem. Okay? I can't assume that I'll always catch you at that moment when it hits 99% and go in and open it just before it shuts down. I have to prevent the problem, and you have to help me do that. That's the way we're going to cure and save lives. So we did a large study, 35,000 men, followed them for 20 years, and we said, what really saves the lives? And 90% of the lives that were saved were due to this: cholesterol medicines, stopping smoking, and blood pressure control. All these fancy tools, the stents, the clot busters, the bypasses, were only about 10%. At the last minute, we got it and saved somebody. That's not the best way to do it. All right, so for heart disease, you really want to decrease your risk. Don't smoke, lower your cholesterol, lower your blood pressure. And you want to increase your survival. Well, early detection. Because we don't want to put people on blood pressure and cholesterol medicines if you've still got that protective coating in your lining. The medicines are strong. They will change your body. And they will change your body in a way to save your life if you have a problem. But they're not appropriate if you don't have a problem. We don't treat your blood pressure unless it's high. And we shouldn't treat your cholesterol unless it's sticking in your arteries with medicine. You should just eat better. So early detection is the whole game for heart disease. Then on top of that, a healthy diet, exercise, and take your medicine. So early detection now, we have really easy ways to do it. We make it inexpensive, and these are done with these plaque or calcium screening scans. And they just say in a minute if you have the lining or you don't. These are two women. They're exactly the same. They have the same cholesterol. And her lining is intact. She has no hardening. And this is plaque. It takes us seconds to see it. That's forming in the arteries to the heart. These are the arteries coming out. We can see it. And if you still have your protective lining, then just check again every 5 years and start the medicine when you have the problem. And if you don't have the problem, just eat healthy and live healthy. I got to keep moving. Let's talk about cancers quickly. I don't have time. This just shows you the differences in risk. So the higher the bar, the higher the risk of dying with it. These are the common cancers. I can't go through them all, and you can't. But the point is there's a big difference, but cancers are bad. Some of these have a 20% chance of killing you. Some of these have an 80% chance of killing you. Lots of cancers. Cancers are complex disease, and they're about mutations. And so what is a mutation? Most of you know, but you have genetic code. It's like a computer program. It's in every cell, and your cells have to rebuild themselves, and they replace themselves. Every part of your body. You know that your hair grows, your fingernails grow, you slough off skin. Every piece of your body remakes itself. Some every day, some every week, some every month. They're all replacing themselves. Every time they replace themselves, they got to recopy the program and hand it on to the next one. And in that recopying, or in between, that program, pieces of that, can get damaged and changed, and that's a mutation. Now, the trick with cancer is it takes about 10 collective different mutations to turn you into a cancer. You got to have a mutation that tells the cell, you don't die. You just keep making more, but you don't die. Most cells, when you make a new one, you kill yourself. No, make new ones and don't die. You got to have that mutation. And then you got to have a mutation that says detach from the cells around you so you can spread out, you don't get crowded. And then you have to have a mutation that says make blood supply and suck it into you. Because you can't build out thicker unless you're bringing in blood supply, because cells have to have blood. You have to have mutations to spread out and to shut off signaling that says, hey, kill this cell, it's dangerous, because other cells look out for cancer. It takes about 10 mutations. Most of the time, when we get a mutation, we repair it or we kill that cell. So on the one hand, it takes a while to get enough mutations. And that is what we call the death and age mutation ratio. This is age on the bottom, and this is the curve of your chance of dying. And what we should see is as you get older, your chance of dying goes higher because everything's wearing out, but it should be a line. But at the magic number in the 60s, it rockets up, because that's where you hit the number where the mutations really start to accumulate. And that's why people have a double increased chance of dying, not just because you're getting older and you're wearing out, but you round a corner based on the lifestyle of the serious things and your risk goes up. So 65 is a time where we start worrying more. It's the tipping point. So let's talk about cancer. How do you get rid of cancer? Well, we're not very good at it. We want to decrease the risk of it. Smoking, alcohol, sun, and obesity, 4 major risk factors, no question. These things increase cancer risk. If you do them, you've got a much higher chance of cancer. But the whole game is early detection and being fit if you get it. We find that those people who go into cancer, and I hate to say this, but are a little overweight and generally healthy, are the best survivors. If you're really healthy, you get more cancers. Or if you're really overweight, you get more cancers. And if you're thin when you get cancer, you got no reserve, and you need a reserve when you get cancer, because you're going to go through a tough time. So the healthiest survivors are those who walked into it generally healthy and slightly overweight. But you don't want to get cancer. You want also to catch. Survival is all about early detection, and that's why we do screening. For men, we start checking your prostate. We do a PSA exam. For women, we start doing breast exams. As you move into that period of risk and your doctor helps you find it, you need early detection. Find a cancer early, and you can cure it. Find it late, we're no good at it. We're not good at it. I'm sorry. I'm going to keep pushing other doctors. We're not good. We're getting good at heart disease and diabetes and infections, and we're fumbling the ball on advanced cancer. It's a complicated problem. All right, what are the major risk factors to dive deeper? Tobacco, lungs, mouth, stomach, kidney, bladder. This is proof, don't question it. Alcohol, mouth, esophagus, liver, breast. Red and charred meat. That's pork, beef, and charred meat. Stomach, colon, rectum. Obesity, breast, gallbladder, pancreas, colon, estrogens, breast cancer, HPV virus, cervical cancer, and exposure to sunlight, skin cancer, and melanoma. This is an important slide. It tells you again about that mutations. So this is your risk from smoking. 1 pack for 20 years, 1 pack for 30 years, 1 pack for 40 years. 2 packs for 10 years, 20, 30, 40. And the important thing you see is that 1 pack for 40 years is a lot more dangerous than 2 packs for 20 years. Okay, that's the point I want to make with this slide. Because again, it's that mutation. Tobacco is the #1 mutagenic substance we put in our body, but it takes time. So 1 pack for 40 years is a lot more dangerous. And you'll see that these spikes really go up between the 20 and 30-year mark. That's where you start jumping up. We have to be screening smokers who have been smoking more than 20 years if we want to catch the cancer. And you need to be talking about your doctor how you can be screened for that. You got to find it early or you're in trouble. Accidents, most of you know through your work, but the big winners here are wear seat belts, avoid alcohol, be careful with certain risk prescriptions. So why did I put that on there? Well, I'm running out of time, but I wanted to tell you where accidents are. Accidents are a major killer. Some of you are in high accident professions, but even though police officers and firemen have high risk of dying, for accidents more than the population, first of all, every fire officer, every police officer does die, and the most of them don't die from their job. Most of them die from what we just talked about, heart attacks and cancer. But accidents are important. You need to be aware, be alert. Don't be drunk. And you need to think, where's the risk? So car accidents are a big thing. Drive heavy cars, wear seat belts, Watch out for other drivers. Don't drive in bad weather. Don't speed. Don't drive drunk. Simple rules and you can stay alert. What are the second biggest accidents? Are drug-related accidents, medicines and non-drugs. So both of those. So people take too many sedatives and pain pills and they overdose, or people take recreational drugs and overdose. And these are lots of deaths. So be careful about substances you put in your body. And that's why I say if you've got prescriptions for sedatives and pain pills, you better be very careful and think about mixing those two. Increased survival, just be alert, be a fit, happy person. Then we've talked about accidents, infections, and I want to quit, but infections are important still. But if you remember all the infections that are killing people, influenza, pneumonia, those are the big killers if we went back and looked at it. Well, you're all told, get your flu vaccine, and after 65, take your pneumonia vaccine. We just saying this, it's not a joke. You hear this all the time from your doctors. Why do we say this? Why do we say wear seatbelts? Why do we say don't smoke? Why do we say take your cholesterol and blood pressure pill? Why do we say get your flu vaccine and pneumonia? Because it really, really matters. These are the big winners. If we do those simple things, death rate's going to go down, stay down, and that's where the people who are in the right side of that curve, 85 and beyond, are the people who follow the simple rules of life. Diabetes, obesity is a major cause. Diet, I'm running out of time, but I just want to tell you, this is meat consumption and risk of dying. So this is pork and beef consumption. And just by different countries, every country. And it's just a straight line. The more beef and pork you have, the more deaths you have, more cancer, more heart disease. It's just a straight line. And the line is the same also for people who eat sugar and flour. The more sugar and flour you have, the more death you have. And so those are the bad boys in your diet. Beef, pork, sugar, and flour. And it's another talk, but there are some very clear reasons why these are just not normal. We don't find flour in nature. We find whole grain, and our body is built to handle whole grain, but it doesn't grind it and crush it into flour, and we're releasing substances that lead to obesity, heart disease, arthritis. These are major health hazards because we love things that have flour and sugar and saturated fats. And that's what they keep telling people. Get away from the sugar, from the processed grain, which is flour, and your red meats. This is a slide that just reiterates what I'm saying. If you stop smoking, how many lives more could we save? 400,000 more lives a year. If we just get people to get rid of the excess of flour and sugar, we'd save almost 200,000 lives or more. Salt, 100,000. Red meat, about 80,000 lives. Excessive alcohol, about 60,000 lives. People who would exercise, about 40,000 lives. Not wearing seatbelts, if we get more people to do it, 30-something thousand lives. We can deal with stress, about 20,000 lives. But the big bang is up here at the top, hundreds of thousands of lives. Anyway, I went over time. It's a lot to cover. But I hope you realize that it's not rocket science. The basic rules, and there's a lot of people trying to sell you stuff, and everything I told you doesn't cost that much to do it. And you can live longer, and I hope you do. Thank you. Yeah, I don't know what their time is. They're working folks, but yeah, if I can help, if I can answer a question, be thrilled to do that.
Anybody got questions?
Yeah. So small amounts of alcohol, I wish I had time to show you. That's why it's complicated. So small amounts of alcohol, an average of about 1 drink a day, actually slightly lowers your risk of heart disease and doesn't increase it of cancer. It occurs at 2 drinks or more a day. It doesn't matter the drink. It doesn't matter what it is. It could be 1 beer, it could be a glass of wine, it could be a gin and tonic, an average drink. So when we look carefully, people who are very mild alcohol drinkers regularly actually do slightly better than non-drinkers. Then come non-drinkers, but then at 2 drinks it gets higher and then the risk just keeps climbing up. Alcohol has some mild benefits and then it's not where more is good, more is bad. Yes, sir.
Along this same line, what about the extremely low heart disease rates in places in Europe? What's the thinking on that now?
Well, so the lowest heart rate and the lowest death rate in the world is in Japan, and they're smokers even, and they're not heavy smokers, but their diet is unbelievably good. So their diet is fish, they eat no processed sugars, they eat no processed wheat. They have a little rice every day with every meal. They have fruit, their desserts are vegetables. So every meal is fish, rice in different ways, and vegetables. And then their dessert is fruit, and they drink a small amount of wine and water. Longest life in the world. The next nearest in Europe is in the area along the Mediterranean, parts of France, Spain, and Italy, called the Mediterranean diet. And it's a very similar diet. These are people who eat a lot of fish, who have a little wine, and eat very little processed grains. They do eat bread, but they don't use saturated fats, and their bread is a rough whole grain bread, and they don't eat biscuits and buns, and they're lean and they walk a lot. So those are the healthiest diets. But all that aside, the difference isn't enormous. So their lifespans are in the order of 88 years. Ours is in the order of 84 or 85 years. We're crowding up against a number because of cancer and because of aging and things. We'll have to fix it. We can get more people living into their 80s and 90s. But to go beyond that, other than a few people, once we push to that number of 100, we've got to change the genetic code. We understand how to do it. It's going to cost money and take time to get there.
What about the relation of Alzheimer's, dementia to heart disease or some of these other diseases?
So dementia, very important and scary to all of us. First of all of us have trouble with your memory as you age and when you're stressed and tired. So just to tell you about how a quick test for dementia, if you have trouble remembering where your keys are, you are normal. If you have trouble remembering what a key is or does, you need to visit a doctor. Okay? Losing things, losing names are normal, and it will get worse as you age. That's normal. You don't even need to think about it. But if you can't remember the concept of a nephew or a wife, that's not the same. If you forget your son's name, that's okay. If you forget what a son is or having a son, that's not okay. Now, there's a couple forms of dementia. The most common has to do with hardening of the arteries. That clogging you saw in the arteries, that's the most common. It accounts for 8 out of 10 cases of dementia. And the treatment for that is just what we showed you. Blood pressure, healthy diet, lower your cholesterol, and take the cholesterol medicines and clean your arteries. The other types, some of those are Alzheimer's. Alzheimer's is an early deposition of a protein that messes up the brain. And it's just a bad disease. It comes in some families. It's not lucky to get it. It's not common. It's a type of dementia. And then there are infections that can affect the brain. So there are other things that 2 out of 10, and Alzheimer's is one of those. And Alzheimer's has nothing to do with your diet. That's just bad luck. Your body starts making the wrong thing. It's supposed to repair the brain just like you repair your body, and it repairs it wrong. It loses the ability to build it right.
So the dementia or the...
Dementia is just the name for your brain is not working right as you get older.
Okay,
But
so
the most common type of dementia is vascular blood vessel dementia, 80%. And then the other 20% includes Alzheimer's and infection and Jacob-Creutzfeldt and Lewy body and Parkinson's. All different can affect it, and they all make up 20%.
The image of the heart that showed, you said that was a relatively inexpensive test. Is this something that's...
Yeah, everyone should get it. And so when should you be screened? And I shouldn't do it. So if you're a male after 45 every 5 years, and if you're a female after 50 every 5 years, females get an extra little protection from their estrogen. And you should be screened, and not more often than every 5 years. And they're called plaque scans, calcium scans, scoring scans. Most hospitals offer them, and they'll range anywhere from $50 to $75. And it takes seconds. You don't undress, and they're 100% accurate. And if you have plaque, you and your doctor should be devising a plan. There are 3 possibilities. You don't have any disease, and you don't have any risk factors. Lucky you. Another possibility is you have risk factors. You have high blood pressure, you have family history, you're smoking or whatever, but you don't have any plaque yet because you still got the protective lining. In that case, just work on the risk factors. Eat better, exercise, stop your smoking, grow up, stop it. We're big people. It's a tough addiction. It's a tough one, but it's a major killer. Let's deal with it. Let's get on with it. You know, and then the third is that you've got plaque growing in your arteries. In that case, get on one of those medicines that dissolves it and stops it. I mean, that's how you change your life. And if you have high blood pressure, also treat that as well. So that's it. After 65, everybody should get the pneumonia shot. All of us should take the flu shot every year. We not only protect ourselves, but we protect children in the community by all of us doing it so we don't spread it around, particularly because we have variations of flu. And some of them that will come can be really dangerous, and we have to be prepared for that. They can kill anywhere from 10,000 Americans in a year. They average about 18,000, but we've had years that it's killed hundreds of thousands of Americans when it sweeps through. And we can prevent this just by the immunity of enough of us having it. It can't get out, it can't spread. So we not only take care of ourselves, but we protect others. Yes?
People that are in their 30s that have had elevated cholesterol for several years, and their physicians are suggesting that they treat that with medication, would a plaque scan be something to do?
Yes, it could be.
That's not really...
Usually at 30, it would be unusual, but I've simplified. There are occasion, rare familial hypercholesterolemia, that people have cholesterols of 500 in their family and they've got deposits in their eyes. And those people we would start scanning, and we might scan them every 3 to 5 years and when they get plaque. But if you just have generally higher cholesterol in your 30, you just work on your diet.
And then still the recommendation is to add 45 for men or 50 for women, get
Yep.
scans and then treat that.
You know, you can discuss it with the diet. If you had a lot of early, you also diabetic and you had high blood pressure, maybe you would start earlier. Yeah, I'm giving you general rules, and I'd want you to talk with your doctor about it. But thank you very much.